State University professors are keeping an eye on these bird flu cases we're seeing across the country. There are no confirmed cases in Utah right now, but still, they're being careful.
34 dairy herds that have been infected with the avian influenza.
Some of America's cows are sick with the avian flu, also known as the bird flu virus.
It is not fatal in dairy cattle, like in poultry.
Dr. Bruce Richards, who specializes in dairy studies at Utah State University, says most cows recover from the illness.
It is an airborne disease.
He says the initial infection of the current outbreak came from wild birds that brought the flu to a farm. Fortunately, there are no confirmed bird flu cases in Utah. There is one confirmed human case of the bird flu in Texas.
Infection in humans is rare.
It's possible for people to get the virus from cows.
Personal gear in the dairy parlor is important.
Dr. Richards recommends farmers or those who regularly interact with cows wear rubber gloves and even masks.
So if you're going between herds wearing plastic booties or rubber boots that can be washed can help.
He says the milk from sick cows needs to be thrown out.
Pasteurized milk is still safe to drink because pasteurization will inactivate the virus.
Dr. Richards says raw milk comes with risks.
As far as cow-to-cow transmission, it's important that we try and reduce movement of lactating dairy cows between dairy farms.
The USDA recently made it mandatory for lactating dairy cattle to test negative for bird flu before crossing a state's border, a requirement that brings relief to this dairy farm. A manager here at the dairy farm told me they're being extra cautious with their robotic milking equipment to prevent any kind of transmission. But he said still consumers should feel very comfortable at this point buying their milk. In Cache County, Shelby Lofton, KSL 5 News.